But today we have the pleasure of having Lisa Johnson with us. She does work at Altman as the Diversity, Inclusion, and Equity Director, and she works in employee relations. So I will turn it over to Lisa and I'll let her get started. So thanks, Lisa, for joining us.
Absolutely, and thank you so much for having me today, Julie. I hope everyone on the call today has been safe and that your loved ones have been safe during this unknown season that is upon us. And I'm going to talk to you about health literacy. And for many individuals who have possibly, had a loved one, most recently, in the hospital, I say that I am hopeful that you have been able to reach out to them to ensure that they're doing okay, because health literacy plays a big proponent in those individuals and their well-being after their hospital visit and or after, the visit with a healthcare team member. And I know during this COVID season, it has put a halt to us perhaps having to visit or being able to visit an individual physically, but hopefully you can do that via a remote access of some format. So I'm going to get started talking about health literacy, and let me just lower down your beautiful faces here so that I can just see this information on my screen. So this picture right here states that our literacy rates here in the United States have not changed in the past 10 years, and that holds true even to date. The USA Today did a study and estimated that 32 million adults in the US, and that's 1 in about 7, are saddled with low literacy skills. And I'll explain what low literacy means in just a second. And many of those individuals have a challenge with reading a child's picture book, as well as understanding the medication side effects that are listed on a pill bottle. Well, many of us even have, trouble deciphering that information. So functional literacy is defined as having math and reading skills or language skills below a 4th grade reading level. And people struggle to read a bus schedule, medicine bottles, as well as job applications. And I will say that for myself working in the human resources department, we've had many individuals come in to fill out and complete their job applications, at the hospital, of course, prior to COVID. And we noticed that many of those individuals did have some reading literacy challenges, and it made them feel more comfortable coming in, asking us questions to help decipher that information. So literacy is very widespread. Many individuals appear very healthy and whole until, they're challenged with a reading assignment or a reading obligation. So you might not think literacy is a problem in the United States. It's a huge problem in the United States. As it states here, 1 in 4 American children grow up without learning how to read. And those who don't read proficiently normally read at a 3rd grade level, which was stated previously. It is 4 times more likely to drop out of school. And 2/3 of the children who can't read proficiently by the end of the 4th grade either end up on welfare or in jail. Ignoring literacy can lead to dire consequences. And some may ask, what qualifies me to even talk about this subject? Because I have a child that is in this category of low literacy. We have sent her to many specialists. We've cried together, her and myself as a young child, even, in her preteen age years, trying to figure it out. Why is it that she's struggling with these literacy challenges and no one can give us an answer? So I understand what it means to have an individual live with them day to day and see them struggle through their schoolwork, through, going to the store, being asked to, read some item, and just this fear that is upon her face. So I totally get it, and I totally understand what this means. So it also says here, the United States has a 99% literacy rate. Yet, as you can see, 43% of adults with low literacy rates are living in poverty. And most of those adults, 70%, are welfare recipients, and they are low literacy. And as you see here over to the far right, $232 billion in healthcare costs attribute to low literacy rates. So we'll talk a little bit about that. We're going to watch some videos to depict real life situations and real individuals who are talking about their struggles with literacy. And I think it'll go a long way with helping us understand those true stories. So the Joint Commission, one of our governing and regulatory bodies, has linked health literacy to patient safety. It says here half of adults can't understand a vaccination chart, and 1 in 2 adults can't read a drug label. Worse yet, poor health literacy is linked to 100,000 deaths per year. 100,000 deaths per year. And we'll talk about why some of those deaths occur. And let's watch this video here, which may give you a little insight. And I will ask on your end, you may have to turn up your volume. We did just test this video, so we know that it works on our end. So you may just want to turn up the volume on your end.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right, 1 capsule.
1 capsule. I don't know this is.
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
I was sick a lot.
Okay, so that video may look like it was a little outdated. However, that video is still relevant today. That video is still being utilized to educate thousands and thousands of individuals even today. And if you were to, go on and you would Google health literacy, that would be one of the top videos that would come up. So let's do a little bit of trivia now and bring it right here home in our own backyards and take a focus and a look at literacy rates right here in Stark County. So amongst yourselves, of course, just take this quick little trivia and take a stab at how many Stark County residents do not finish 9th grade. Out of those individuals, how many do not graduate? And out of Stark County residents, how many live below the poverty line? Of course, I'm going to give you the answer. If you answered B, you would be correct. 3% of residents do not finish the 9th grade, while 10.9% do not graduate high school in Stark County. 13.3% of the population live in poverty or below poverty lines. So, of course, there's a missing link between teaching low literacy students and basic literacy skills. The Ohio State University did a study and founded that students in the 1st grade fared significantly high in reading skills amongst their age group for the past 12 years ago. But we find that there is a literacy gap in individuals who start out with very high reading levels and those individuals who have been in maybe the low reading level categories. I know when I was back in school, we had reading centers. And if you read at this level, you would go be in group A, which is the higher level of reading. And then there was group B and then group C. Well, as time goes on, the studies find that those students in the lower reading groups, the gap started to widen further and further. They would be pushed down further and further on that chain of literacy. So many teachers and many educators, higher education, as well as preschool and elementary education, as well as, high school teachers are taking a profound look at this to ensure that all students are able to read at a certain reading level and that no one is left behind and that they are acknowledging each and every individual, no matter what stage they're at. So, of course, knowledge is definitely power. And I want to just inform you that there was a recent study done by Gallup on behalf of the Barbara Bush Foundation for Family Literacy. And it founded that, of course, adult literacy now in the US has become a $2.2 trillion a year. $2.2 trillion a year focus on literacy. So according to the US Department of Education, 54% of US adults aged 16 to 74, about 130 million people lack proficiency in literacy, reading below the equivalent of a 6th grade level. And that's shocking. That number is very shocking for several reasons because of the dollars and the cents that implicate an enormous correlation between important factors such as personal income, employment levels, health, and overall economic growth. So British Robinson, who is the president and the CEO of the Barbara Bush Foundation, says that America's low literacy crisis is largely ignored, historically underfunded, and wholly under-researched, despite being one of the great solvent problems of our time. Solvable, So this is a solvable problem. She goes on to state how low literacy prevents millions of Americans from fully participating in socially or economically as a parent, as workers and citizens, and low education attainment contributes to enormous equity pay gaps that exist in our country. So here's one of the societal issues of equity, and that's the pay gap. Research clearly shows that investing in adult literacy is absolutely critical to the strength of our nation. And she goes on to lastly state that Barbara Bush said over 30 years ago, and it remains true today, that literacy is everyone's business, and it definitely is everyone's business. So as you can see here, low literacy rate attributes to high hospitalizations and also return emergency room visits. Out of some of those return emergency room visits and hospitalizations results in those high death rates of 100,000 or more, because usually individuals did not understand, as you saw in the video, how to take the medication. They didn't even understand the homegoing instructions after a surgical procedure and what, the necessary steps were, when to even return for a follow-up visit or when to even call. Oftentimes these people are so embarrassed because they don't understand the material, so they're too embarrassed to even call to say that something has gone wrong. So what are we doing from Altman? We've got a lot of things going on. Of course, these signs probably mean a lot to everyone. We see these out on the street. We see them everywhere because we know that signs and words go a long way to help individuals that have literacy limitations to literacy and are low reading levels. So we have signage throughout our health foundation, like as you see at the top, outpatient lab. But what does that mean to somebody who has a low literacy skill? So we're working on our end to even change and help with some of our signage and maybe put a syringe there with some blood droplets to it so that individuals will understand that, oh, that's the lab right there. And then we have one there, as you see at the bottom, is the shops. Well, what does that mean if I don't know how to read? What does the shops mean? Well, how about put some gift items? Or now we sell, food in our gift shop. So how about a gallon of milk so then individuals are aware, of what this information is. And I will tell you, we have some of our own team members that, function. Of course, they're high functioning, but their literacy rates could be very, very low. So we want to help every single individual. So we're going to take a brief look at this video here, but not in its entirety. I did include it at the end. So if you'd like to watch it in its entirety, feel free. I'm going to skip just past the very beginning here, just a few seconds.
I have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Health literacy is the ability to read, understand, and act on medical information. Unfortunately, millions of adult Americans lack adequate health literacy skills. The doctors, researchers, and patients in this video are real, not actors. The situations, frustrations, and complications are also real. Nearly half of Americans have health literacy challenges. Odds are some of them are your patients.
Can you imagine what it's like you being a patient and sick, and you know that you have limited skills, okay? And you're talking to an intelligent doctor like yourselves. And these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
The heart of the problem is a disconnect between patient ability and healthcare communication. The average American reads at an 8th grade level, but healthcare information is often communicated at a college graduate level. This disconnect leads to confusion, frustration, and a feeling of helplessness for patients and physicians. While healthcare information can confuse even highly educated patients, those most vulnerable to misunderstanding are the 1 in 5 adult Americans who are functionally illiterate.
Take one capsule.
That's right, one capsule.
One capsule. I don't know what this is. Twice daily.
Okay.
Okay.
So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
For people with limited literacy skills, the world can be a challenging one. 21% of adult Americans can't read the front page of a newspaper. 48% can't decipher a bus schedule or make sense of a bar graph. The problem is even worse in the healthcare setting, where emotions run high and vocabulary is unfamiliar.
Based on our decade of research on health literacy, our research group has documented clearly that patients who have inadequate health literacy are more likely to be hospitalized for their chronic illnesses. And this is regardless of their socioeconomic status, whether or not they have a primary care provider, regardless of how ill they are.
And tell me which one is which and what you take them for.
That looks like my medicine that he gave me for the morning. I take that and the little pill that, no, this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me on there and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Research has shown that many patients have a hard time understanding basic medical instruction. 26% didn't understand when their next appointment was scheduled. 42% didn't understand instructions to take medication on an empty stomach. 86% couldn't understand the rights and responsibilities section of a Medicaid application.
Do you know what
So again, I included that video in its entirety at the end of this actual presentation.
hypertension?
Let me see if I can move past that. Okay, so some things that we do on our end as a medical professional team members is something that we call teach back. So we ask a number of questions to ensure, that our patients that we're caring for, our customers, really understood, the information that we're presenting to them. So we'll ask them, tell me what you understood, or explain it back to me. How would you take this medication? At what time would you take it? What would you utilize to take this medication if it was something, say, an injection for a sub-Q for insulin or such? And then we want to also ensure that their visual components are intact. So can they see what you're presenting to them? Because a lot of times we give all this printed material, and sometimes it's in what I'd like to call -6 font because it's so tiny, or you get some of those medication inserts and the wording is so tiny. And sometimes I want to read the whole thing when I get, a new medication, and some of the information is so small. But thank goodness for, having access to Google and to call the pharmacist to ask them to explain some of that information. So you also want to ensure that if you're not a healthcare team provider, but if you're caring for a loved one, that you ask them, can you show me how you would take this medication, or what you would do? What type of treatment do you do? Say if they had a wound, how would you change your wound? What would you do? So that goes a long way to help individuals to ensure that they understand the information. But equally compounding is a language barrier. So if you already have an individual with low literacy skills, imagine an individual with low literacy skills and language barriers. And I know from several of our team members, this is an extreme frustration for them, which I clearly can understand, because it makes it equally as difficult to ensure that an individual understands the information that you are presenting to them. So as you see there, we have these 2 items called our critical communicators, and they have pictures, again, with words that help with understanding of what's, being presented to individuals. But myself and my team, I found this great tool probably like 3 years ago. I've been presenting this now almost 3 years straight. And I found this tool that a young college student had created who worked in Sub-Saharan Africa to help those individuals, those patients, understand how to take the medications or how to give medication to their children, and how to report signs and symptoms if they were feeling, some type of way, as you see there across the bottom. And I thought this was great. So myself and my team are going to recreate something like this for our patient population at Altman, because oftentimes, again, patients return because they say, I didn't understand how to take that medication that was given to me. It said, just like the woman in the video, it says take it, twice a day. And I just feel better about taking both at one time because I don't know what time I should take that medication. But that can be harmful and risky if you're taking a multitude of medications that should be spaced out or not taken at the same time with other types of prescription drugs. So I also included here a more recent video by Lisa Fitzpatrick. It's called Dr. Lisa on the Street. So she's going out and she's asking individuals about the flu shot. So when you have time, you may want to watch that video. I also included the health literacy video, and you just watched a few minutes there at the very end, but it is 23 minutes in its entirety. So feel free to engage in that video as well. And I will stop there and open it up for any questions from anyone at this time.